Hello, this is Amanda Sturgeon, and this is my curriculum project. So the program type is a Bachelor of Science in Nursing. Structure would be a combination of traditional classroom and online, and perhaps even some hybrid classes. This would be over 8 semesters or 4 years. So the model would be a basic BSN model. So years 1 through 4 would be a combination of general education classes and foundational courses, but I would have an early start of the nursing courses as well as integration of some of the nursing concepts in the science classes and some early clinical exposure. Come on, mouse. So my curricula design would be a core curriculum. So everybody would have to take the same core classes, but I would have a student-centered fusion flair. So the students would have some choice, and there would be some new classes that are a fusion class, a combination of health assessment in anatomy and physiology, or we would start taking pharmacology in pathophysiology. My classes would incorporate many patterns, including spiraling pattern. So some of the information is going to be repeated at a higher degree of difficulty. It would incorporate a skills design where some knowledge and experiences are designed to teach the nursing processes and practice, and a process design, so emphasis on concepts to be learned and some flipped classrooms. For my transdisciplinary interprofessional education, I would try to have nursing students and some med students get together for some simulation, if that's possible. I think this would help increase the communication between the two professions, and they would get a chance to practice interprofessional collaboration in a simulation and perhaps even change roles. The educational framework I've chosen, or philosophy, is a concept-based curriculum, not to be confused with concept-based learning or an approach, but the entire curriculum would be concept-based. So why would we switch to an entirely new way of teaching or a new curriculum? I know that's something relatively new. There's not a lot of schools that use a concept-based curriculum yet. I believe it's probably difficult to switch it over. But why would we want to do this? Why reform curriculum? To better prepare nursing students for the next generation NCLEX. I believe that starts supposedly 2023, and it's going to start testing clinical judgment. That's difficult, and that's clinical reasoning and critical thinking is difficult to teach, but I believe that concept-based learning can help that. To meet workforce expectations and lessen the gap between practice and education. Change from a teacher-centered approach to a student-centered approach, so less lectures, more flipped classrooms, case studies, things like that. To promote thinking and problem solving in the classroom and reduce the amount of information. We would just learn core concepts and not every disease process but perhaps just fluid and electrolytes. And then after we discuss fluid and electrolytes, we would immediately go to a simulation and put that into practice to hopefully facilitate deep learning and to keep up with the changes in healthcare. Those are the reasons I believe we need to reform curriculums. So a concept-based curriculum hopefully would reduce some of the information overload by learning just the core concepts, not every disease and every disease process, but we would learn fluid and electrolytes, and we'd learn it really well, and we could apply it, hopefully, to all the disease processes, and reduce the amount of learning and reading, but hopefully deepen the learning. So we wouldn't just be memorizing tons of information. The approaches utilized would be, again, a learner-centeredness, so flipped classrooms. Students would lead. They would have to be prepared, have to do some reading ahead of time, but lectures would be minimal, case studies, and it would be a lot of discussion and them choosing some of the student-centered approach, learner-centeredness, giving them some choice. And then hopefully that would facilitate deep learning, where we explore the concept, give them some choice, and develop some critical thinking skills. So, as we've learned in the essentials of baccalaureate education, we need liberal education, and I believe it is necessary to understand oneself and to understand others, to recognize social injustices and ethics, and to promote engagement in the community. Of course, we need to stay on top of the latest research, so we'd have research class, evidence-based practice, safety, informatics, perhaps get to practice on a real EMR, and we would also have clinical practice and simulation, again, where we learn a concept and then immediately try to go practice it in the Sims lab. In my curriculum, liberal arts education would happen concurrently throughout the program to keep it fresh in the student's mind and to demonstrate how relevant it is in nursing education and the profession. And I would introduce clinicals and nursing courses early to help students begin to identify their nursing identity and learn how the sciences are integral in nursing practice. So here's an example of my classes. Year 1, we'd have A&P 1, growth and development, English, chemistry. Spring semester, we'd have psychology, English composition. And here's my fusion class of A&P 2 with health assessment. So when they're learning the anatomy, they could learn how to assess it properly over the valves. What would you hear? Bones, the tibial tuberosity, what do we do? Maybe that would help put into place the health assessment. And we'd have clinical calculations. Year 2, we'd have statistics, a nursing foundations course, patient-centered care to introduce nursing early. They would have some minor clinicals or perhaps simulations started year 2. And here's pathophysiology with pharmacology. There would be Sims included with pharmacology, and perhaps they can understand how the meds work in the body while they're learning patho. Spring semester, we'd take Spanish for medical providers, and we'd have our first real nursing course, Fundamentals of Nursing, and we'd have clinicals, first real clinicals with that, and nutrition. Year 3, Nursing Management of Care. We'd have evidence-based practice, research class, and an arts elective. Spring semester, nursing management of care 2. Those are our main concepts that we'd be learning: fluid and electrolytes, perfusion, cognition, and hopefully that would be some deep learning they'd understand. We'd have nursing care throughout the lifespan. That is year 3 and year 4. We'd have 1 and 2. We'd really cover that well. We'd have a nursing elective, perhaps critical care nursing, rural health care. We have our informatics class, and then an advanced pharm class. We make a lot of med errors, and it's a lot of medications to learn, so I think pharm should be twice. I'm a pharm fan. So we would have an advanced pharm class, perhaps the critical care meds, more IV medications, discuss the ISMP's recommendations for safety. The spring semester, last semester, we do QSIN and safety, our professional issues in nursing. I put sociology in the last semester. I believe it's hugely important and follows along with our code of ethics, and I want it to be fresh in new nurses' minds. And then we'd have our global health, public health class and a practicum for that. Over here we have the admissions criteria, and I chose a 2.5 GPA. I know a lot of schools have a higher GPA, but sometimes it doesn't actually accurately represent who that student is. Things have happened, and maybe their GPA would keep them out of some nursing programs, but if they have good scores on their Kaplan entrance exam, then I believe they should have a chance to get into the program. And here's my student learning outcomes. So graduates will use clinical judgment through critical thinking and reasoning to provide safe and effective care across the lifespan in a variety of healthcare settings. Graduates will improve patient outcomes through leadership, communication, and collaboration. Graduates will continue to support their fellow nurses professionally and personally throughout their career. And there are my references. Thanks so much.